Welcome to this week's video. Today what we're going to look at is one of the subjects that I'm most passionate about, and that's chronic pain. And particularly chronic pain and the fear attached to movement with chronic pain and back, hip, knee, anything which has been going on for more than 3 months. So particularly we're going to look at today at chronic pain associated to sciatica and pain radiating down the side or outside of the leg. And also there's a article I've written that to accompany this post, which will go into some additional details. So I know from experience how debilitating lower back pain is, back pain, neck pain. And I know also the fear attached to when you start moving again, you're frightened that pain will come back. So as long as you've gone through the various channels of X-ray, MIR scan, doctors follow up, and then maybe physio or be going through physio, we know we're dealing with something that needs movement. So with sciatica, we need to be able to lengthen the connective tissue, because nobody I've come across, there's not one student that I've seen in my time of teaching where the hips are not tight as well as the back. So we need to get this area open. We need to be able to stretch the muscles, the connective tissue into the lower back, gently and controlled, and down into the hamstrings and into the hips. So this video is going to be about when you're in that quite very new stage where you've been diagnosed with something. Maybe it's a prolapse disc. We hear a range of them, so it would be slip disc, prolapse disc, herniated disc, inflamed disc, protruding disc. All of them send fear into people because it's often not given with full explanation. So, taking in consideration you've gone through the normal channels and you've been recommended for physio, then these are the postures that are going to help with getting some length, getting some flexibility and getting some ease back into the area. Remember, we need to move the area in a controlled way. So for some people, this just sitting in this position is uncomfortable. So find a position, whichever, so it can be the legs out, you can have higher cushions underneath, but make sure you're sitting on a cushion. But what we want to try and avoid is this continual sinking of the lower back. So notice, if I collapse the lower back, and it's a guarding of the lower back that many people with lower back pain do, you sort of sink back down into the tailbone, and we need to get some length up through the back. We need to start using these muscles, and we need to start getting some opening into the hips where this sciatic nerve runs down. So we want to find a position that allows this spine to come back into its normal range of movement. So every time you feel yourself sinking down, see if you can bring your awareness back in, growing up tall from the tailbone to the crown. And if that is just too much, then take it day by day. Just come into a seated position, lifting the lower back up, lifting the hips up, sitting in a straight position, relaxing your shoulders and allowing these hips to start coming out, getting a little bit of movement, getting this IT band, a gentle stretch, and just checking into this back and trying to keep it straight. Now when you're in chronic pain, you're going to tighten up. I appreciate that, and we need to think about the breath. So let's think about getting this breath. Let me turn back around again. So let's think about getting this breath into a state that releases the tension in the body. Remember, we're not learning something new, we're coming back to our natural state. So finding a position that allows that nice long spine, getting a nice stretch, natural movement, and again, back off every time you feel you need to sink. You might have reached your maximum, and then come back to it the next day. And then we're just going to close our eyes and spend a few moments thinking about this natural breath. So closing the eyes and thinking about the foundation, where our power, our energy center is. It's that base chakra in a lot of the physical practice of yoga. So we want to slightly activate the pelvic floor muscles, gently drawing it up and just finding some length through the back. And think about all the time this tailbone to crown. And from here, we're going to take 4 nice deep breaths in. As we breathe in, I want us to soften the belly, creating that Buddha belly, nice soft belly. And that releases the muscles. The muscles become soft. The diaphragm can work with ease. It's not trapped and contracted. So allowing the belly muscles to be soft as we breathe in. And as we breathe out, we're gently going to come from the base. We're going to lift up slightly from the pelvic floor, draw the lower abdominal muscles in, activate the diaphragm so it can release all the carbon dioxide. Let's do that together for 4 breaths, taking a nice deep breath in. And then relax. Softly opening our eyes, keeping that softness in the breath. So as I said, if you're just coming into that chronic pain, so it's still very, very new to you, doing that 3 or 4 times a day, starting to bring this awareness down into the stomach, get the lower abdominal muscles working, draw awareness into breath and just calm this tension in the body that accompanies chronic pain. And then just carry on with that for a few days, and then let's go into the second stage. So we need to get this back moving and in a very controlled way. Now, the minute you start moving anywhere that has any pain reaction, we're going to tighten up. Again, it's that normal reaction. But a lot of it is coming from fear. It's fear, so therefore that experience is going up through the spinal cord into the thalamus and creating that tension back in the body. So everything we do, we want to come in with a nice deep breath and then expand and release in the exhale. So literally all I want us to do is just bring the body from side to side. So notice I'm not rocking like a pendulum, but working into the side muscles, working from side to side. So we are bringing a stretch into this side, and this side is contracting down, drawing the muscles together, and then over to the other side. Now let's do that with the breath. So we're going to breathe in, and as we breathe out, just come down to the side. And breathe in, coming up tall, and over to the other side. Let's do that a few more times. In, and out. And again, in, and out. Now immediately notice your shoulders. If you tighten them up, relax the shoulders down, find softness. Automatically, when we start moving, we start tightening up, so keep remembering to relax those shoulders down and notice the breath. Try not to be breathing up here, but breathing down here. The minute we breathe up into this area, it's to do with the fight and flight. We come into that stress tension again. So breathing down, just keep bringing that awareness. That even if that's all you do, first of all, just keep breathing down into that stomach. And we also want to breathe in and out through the nose. So sometimes you might notice I'm breathing out through my mouth because I'm talking at the same time. But for your practice, keep breathing in and out of the nose. Because if we're breathing out through the mouth, again, we can only breathe out from the ribs. We can't get down into the stomach, and that's where we want to release the tension. Okay, so now we're coming into one of the most popular positions to release lower back pain and also to get some mobility, and that is our cat-cow. So we're going to do it slightly different because, as I said, I haven't come across a student in all the years of teaching that hasn't got tight hips as well as the tightness in the back. So here we're going to bring our knees directly underneath the hips, hands underneath our shoulders. So again, don't tighten up. So we have a tendency here, we can drop down into the shoulder girdle, and I want us to bring that awareness up through the shoulder girdle. So the position is more like this. We get this nice activation into the back of the neck. And here, what I want us just to do is rock the bottom from side to side. It's as though we're wagging our tail like a dog. Make sure we haven't sunk down. Keep that back, that flat back. Draw the navel up slightly, but not enough that you are really tensing the stomach muscles. And we're just going to rock from side to side. This nice movement, rocking from side to side. Finding a nice gentle release. Let's work with the breath. Nice deep breath. Remember, don't worry about the stomach hanging down. That's what we want. We want to breathe in and allow the stomach to hang down. Really getting this expansion and then drawing gently up from the pelvic floor on the exhale. Let's do that a few times, rocking into these hips. Now, if you find that you're clunking in the hips, take the knees a little bit further apart and just gives you a little bit more space into the inner thighs. And then we're going to draw some circles as though we've got a paintbrush attached to the back of our trousers, and we're just going to be drawing circles. And let's see if we can get a little bit deeper, soft into the shoulders and arms, up and rounding into the back. So it's a little bit like this cat pose, up, but we're moving all these back muscles. We're going to go the opposite direction, round, down, up. Keeping that breath soft, don't let it go. Keep the softness in the body. And release. Now bring the knees in together, and we're going to gently send the tailbone up towards the ceiling and allow the stomach to come down. Now this position often feels very tight when you've got chronic back pain. So here I want us to just touch in to the stretch. So we don't need to come down to our full expansion, just touch into the stretch. So we're getting some movement into those hips, into the lower back, into this big beta fascia, into the lower back that loves this smooth rolling movement. And then we're going to tailbone down and round up, draw the navel, not with tightness, but this soft drawing up towards the back, keeping the shoulders nice and activated as we gently find that stretch from the tailbone to the crown of the head. And let's release again, bring the body down, relaxing, again, not to your full potential, just enough so we get that stretch. Keep it nice and soft today. And then back up again, tailbone down. Remember the breath, don't let the breath go where you're focusing on the movement. And we're going to do that a couple more times. Now, if you're starting to panic because you're feeling a tightness, check into that breath. Check into the breath. Get the body flowing. The body needs to move. We need to stretch the connective tissue, allowing this nerve to gently find its role in creating stability in our nervous system, not that hyperactivity. And release. And now we're going to come into a seated posture, which is a twist. So, again, our backs don't just move backwards and forwards and side to side as we started. The back is a collection of joints, and so it likes movement that allows this twisting in. But when we've got tight hips, that big movement is very restrictive, and we've got to protect the back, so we don't want to force. This is why I don't often use the hands to lever us round in a twist. We want it all to come from the back. And again, what I want you to do is just touch into the stretch and then back off. Just touch in. So we're never coming into that tightness. We're just touching in and backing up, backing off, and getting this nice fluid movement. As I said, the fascia in the back really likes this fluidity. So here, what we're going to do is have our hands on the knees, bring our awareness back down. So remember, if you find it difficult because of tight hips, you can use a cushion to lift up or have your legs out in front. It's going to do exactly the same. And what we're going to do is literally just think about the tailbone to the crown, and we're just gently flowing round. Notice I'm not bringing my hand round, we're not forcing this, we're using the back muscles, twisting and releasing. Twisting and releasing. Now let's bring the added layer of awareness. Gently engage the pelvic floor muscles, you know, the key muscles that are creating this protective girdle. Gently lift them up. So we're not tightening, we're not feeling contracted, but just an activation. The lower abdominal muscles gently activated. And we're going to do this with the breath, breathing in and breathing out. Breathing in and breathing out. And again, breathing in, let's get this fluidity, and breathing out. And relax. And now we're going to do one more seated twist where we're going to hold. So we're going to extend one leg out in front. Where this leg is, it's got to be in a position that you find comfortable. So if having the foot, the insole of the foot up through the thigh is not comfortable for you or puts too much pressure on the back of this knee, then we bring the leg down into a position that allows the knees to open, not too much tension into the hips. And what else we could do, so I'm going to sit on the block to lift up my lower back, so a foam block, not anything hard. If you have problems with the knees and it becomes painful to have the leg out in front, often back, knee problems come together, then just pop something underneath the knee, so you're not pushing down into the back of the knee, but that little bit of softness. And then have this foot exactly where is comfortable for you. So first of all, we want to find a softness in this leg. So just a little bit of a butterfly movement, leg coming up and leg coming down. So when we come into this position, we need to start thinking about what's happening with the rest of the body as well. So that pelvic floor muscle, gently activated. Remember, it's your base sharpener point, it's your foundation. So that gentle activation, lower abdominal muscles gently activated, and lifting through the spine. So we find length and allow the space of the stomach muscles to relax in and out through the exhale and the inhale. Dropping that leg down, so we can do this. So as we breathe in, nice deep breath in, leg comes up. Notice we're getting a little bit of activation around the hip joint, maybe into the IT band, that's where we want to be moving. Check, we haven't sunk down. Breathing out. And breathing in. And again, out. So I'm gently easing that leg down, I'm not forcing, breathing in, and I'm not using the hand to lift it up, I'm using the muscles. Up, keep that pelvic floor activated, back nice and tall. And check the shoulders haven't tightened up. Up. And release. And then from here, we're going to gently activate this leg. So the kneecap comes up slightly, the quadricep muscles slightly activated, and we're going to come round like we did with when we were in the cross-legged position. So we're going to come round, breathing in. Again, fingers touch, and we're not using the hands to pull us round. We're using the muscles, round. And check we don't feel the stomach muscles activated. So what happens is when you're very weak in the lower back, we're going to start sinking down. And I notice students rocking back. So in this position, because what they're doing is bracing themselves, using their stomach muscles and not the back muscles. So if I'm rocking back in the position, I'm using my stomach muscles. So the minute you start feeling the stomach muscles activated, and that's the dominance, you know you've come back too far. So let's do a few more. Growing up tall. Nice deep inhales, feel that twist through the back, get these muscles moving, round, breathing, and again, round the other side, coming just enough that you could feel the muscles starting to work. Remember, we want to start feeling that warm, as it said, burning sensation sounds so negative, but that's where the muscles are starting to move and work. If we haven't got problems in the body, we wouldn't be worried about feeling the muscles working, but try not to link the movement and this feeling, this aching or burning sensation into the muscles as a negative thing. The minute we start feeling a sharp shooting pain, we need to back off, and it's not because we might have hurt ourselves or pushed ourselves too much. It's a body warning system that says back off. And so what we would do, just back off. We wouldn't go too far, just keep the movement, and then notice, see if by backing off that movement stops. Also check into the breath again. Make sure your breath hasn't come up, but a few rounds of breath, and then try and come back into it, but maybe a little less. And then let's work on the other side. So first of all, again, if you want a little bit of release on the knee, and then we're going to find a position here that's comfortable with the leg. Remember, it doesn't have to be up into the inner thigh, it can be down here. But what we're trying to do is get this opening into the leg. So I'm going to put this side, I'm going to have mine just on the inside of the knee. It's not touching the knee, so it's not pushing into the knee. But here, and then we're going to come up. Remember, keep that back nice and tall. Make sure we haven't sunk down into the back. So when the back starts getting tired, it's a habitual habit where we sink down. But notice when we sink down, we squash down into the diaphragm, and the breath can't flow. And we come straight back up into the chest when we're breathing, reducing the amount of oxygen, allowing the carbon dioxide to be resting in there and not being released, and therefore every cell is going to be affected. Our level of energy is going to be affected, our ability to rejuvenate the cells, getting that energy and vibrancy back into the body. So it's so important. It's not just about having this long spine for creating muscle strength, it's also about getting that oxygen exchange coming in and out successfully. So let's work with the breath, breathing in as it comes out, down as we release. Let's do a couple more. In, up, down, and release. And one more. In, and out. And then let's come round to the position where we get that gentle stretch. Realign, kneecap comes up, activation into that thigh. Relax the breath, relax the shoulders, and just this gentle flowing breathing. Round. And release. Round. Keep the shoulders soft, round. And release. Two more, breathing in, keep that back nice and soft, shoulders relaxed, round, and release, and relax. And then what I want us to do is stretching the muscles around here. So remember, I said earlier, the sciatic nerve is coming around here. So we want to get a nice stretch into the hip. Again, hip, lower back pain, very linked together. So we often get tight hips caused. We never really know which ones come first, but one generally leads to the other. And I'm going to keep myself nice and warm as I'm laying down onto the floor. And so we're going to bring our backs down onto the mat, bring our feet up towards our bottom as though we're into bridge pose, and then bring one leg on top of the other. So if you've got really stiff knees, it might just be that you're resting on top of the knee. If your knees are okay, and it's not that, it's just the hips and the back, then bring the foot a little bit closer. And we're going to do exactly the same as we did. It's like that butterfly movement, in and out. And we're going to do this 8 times. So let's work with the breath. Breathing in, leg comes in, drawing in, breathing out, leg comes out. Okay, breathing in. Nice soft breath down into the stomach, breathing out. Breathing in and out. In let's have 4 more. In and out. Breathing in and out. And let's have 1 more. In and out. And then let's release that leg, bring that leg down onto the mat, this leg up. Again, find a position that's comfortable for you. We can still get some movement if the ankle is on the knee, but let's see if we can bring the ankle a little bit further down onto the thigh, get some more of a movement, more of a stretch. And we're going to do exactly the same, breathing in to the body and breathing out, just like a butterfly wing, coming in and out. And then we want to make sure that the movement is working with the breath, so it's not making the breath short by condensing the movement, but we want the breath nice and long and relaxed, making sure it's the breath that governs the length of the movement. Okay, let's do 4 more. Guiding you through the breath, breathing in and breathing out. And in and out. And in and out. And in and out. And then release. And then I want us just to bring the left hand onto the left knee, right hand onto the right knee, and draw the knees in towards the body and out again. And then what we're going to do is link with the breath.
So I like to, as I bring the knees in, I actually like to work on an exhale. And as I'm taking the knees away, I like to work on an inhale. See what works more for you, because some people like to work the other way around. So whatever feels more relaxing. Remember again, don't let the movement dictate, but the breath dictate. Couple more, in and out. And last one, in. And then bring the feet down onto the mat, a little bit further away from the body than it would be if we were in bridge pose. And now I just want you to gently rock from side to side. So keep these movements just small enough that we're getting a twist and a stretch into the fascia, lower back, connective tissue at the lower back. Just a gentle movement from side to side. Keep it fluid, smile, keeping the body soft, check into the shoulders, making sure we've got no tension in the body. And now let's work with the breath. Breathing in, bring the knees up. Breathing out, bring the legs over. Feeling a stretch through to the back, into the hip. Breathing in, bring the legs up. Breathing out, bring the legs over. Let's do one more. Breathing in. Breathing out. Excellent. And now what I want you to do is using a chair. So I have a chair here ready. We're going to do our relaxation with the legs onto the chair. And so here, bring the body towards the chair. Bring your feet up. It could be a stool, but something that allows the legs to be higher. Bring the body down. Bring the hands down into a relaxing position. And this is the position I want you just to rest in for about 5 minutes. So you can put some music on and just relax, concentrating on this breath. Breathing in, finding space, and breathing out, just drawing up from the pelvic floor, flattening the lower back in and relaxing. I want to leave you there to do that for about 5 minutes, just concentrating on the breath, concentrating on finding a softness in the body. So relaxing down, and I will join you for our next video on getting this back moving next week. Namaste.